Hello and welcome to yet another episode of Doctors In. Today we have with us Dr. Ahmed Labib, who have been specialized in orthopedic surgery and sports injuries from Zahra Hospital, UAE. Let's welcome him to the program.
Yeah.
Welcome, doctor.
Yeah, hi, welcome.
First of all, we would like to know more about you.
My name is Ahmed Labib. I am an orthopedic surgery consultant in UAE, working as sports injuries consultant in Zahra Hospital in Dubai, and I'm an associate professor in Cairo University Hospital. I've been graduated and took my MD degree in 2001 after special training in Münster University in Germany, and since 2002 I'm only doing sports injuries arthroscopic management.
So what are the prevalence of sports injuries?
Sports injuries is one of the most commonly faced topics by an orthopedic surgeon in his clinic. Young population is getting more enthusiastic for doing more and more sports, and sports pattern is changing now from the regular pattern to we have the extreme sports here, especially in Dubai and in certain European countries. So the injuries are getting more and more severe, and we are seeing more of this. In our hospital, we have a specific team working only for management of sports injuries, and our hospital is accredited by Dubai government to be one of the major lines of management for overseas patients in compliance with the medical tourism program. So we are getting more and more of these sports injuries, either from within the UAE, especially from Dubai, young, active, enthusiastic expats doing a lot of sports, extreme sports. Nowadays are prevalent and getting more and more to be familiar with the normal populations, and from overseas, from certain countries in Africa and in the Far East and in the Eastern Europe, in compliance with the medical tourism program run by the Dubai government. Our Zahra Hospital in Dubai is one of the main lines and main hospitals in the private sector accredited to do such job.
So how can we prevent this?
Prevention of sports injuries is actually more important than treatment, and I can see a major defect in this. People go directly into sports without having a special trainer preparing their bodies to be fit for the special type of sports they're gonna be in. We see school children after school, they are having after school activities and directly into soccer games, directly into volleyball, tennis, whatsoever games they are going, without having special training program over the week for such sports to be fit in. And this is very important because one of the major causes of non-contact injuries is lack of fitness. You can see it on the other hand in office workers. He have been in the office for the last 3 or 4 years and he gained a lot of weight, and all of a sudden he decided to go to the gym and to reshape his body, and then he injures himself. So the prevention is with the gradual proper training to be fit to do the sports. It's not directly to training to be perfect in the sport. It will not go this way. You have to be fit before going into specific sport, and the fitness program have to be assigned by special training for each type of sports.
So now what are the primary management for an injured person or a child?
Usually when we have an injury during a sports, it's a joint injury or a muscle injury, and the immediate application of ice immobilization is very important in the primary management at the scene of the play of the game. Second thing is to stop the game. Some people, I see them, I fell down, I heard my knee popping and clicking, and there was severe pain, but after quite a while the pain subsided, so I continued playing. He simply transferred his partial injury into a complete injury because he comes saying, but on the next day the swelling became more and more and more. So the primary management is ice immobilization. Discontinue what you are doing and as soon as possible seek professional help.
So now what are the treatments that you offer for this?
When you have a special team for management of sports injuries, they really know what to do. The primary management for a knee, ankle or a shoulder injury is basically the same. We give an anti-inflammatories, complete rest to the part, for example 2 crutches if it is a knee or lower limb problem, knee brace or an ankle immobilizer, shoulder arm sling, anti-inflammatories, ice. And then we request an MRI investigation for this patient to see precisely which ligament he damaged.
Okay.
If there is no ligament major injury, the patient after a period of rest, immobilization, when the swelling subsides, the pain goes, he must be subjected to a physiotherapy or a rehabilitation program in order to restore the function to the injured part before going back into sports.
Okay.
And this is a very common bad habit I see. Patient after 2 or 3 days, the pain subsides, he goes back directly into the sports. And then he gets another re-injury. And I see this a lot. The patient tells specifically, I got this simple injury 10 months back, but since then, when I stand, when I walk, when I try to run, I get the pain and swelling in the ankle, for example, or in the knee, or clicking in the shoulder. Because simply after the injury, the function must be restored by a specific physiotherapy or rehabilitation program. When in the MRI and by the examination there is a ligament injury, then the plan is different.
Okay.
This ligament must be fixed, especially in professional athletes. And we have to do this as soon as possible, especially in professionals, because the more time goes, the more muscle wastes, and the more stiffness he gets, and the difficult the rehabilitation
So it's risky.
later. He will not restore the primary 100% function if the management is delayed.
Okay.
According to the injured ligament, we put a plan for the management, and nowadays all of the injuries, sports injuries, are managed arthroscopically. Keyhole surgeries.
Yes,
we don't
keyhole
open and cut. In the 90s, we used to restore the cruciate ligament, for example, by completely opening the knee, and then the patient stays in pain and limitation for almost 3 or 4 months, and it's not before 1 year when he go back, and usually it's too late. His muscle is wasted, the knee is stiff, and he cannot. No, nowadays with the recent techniques that have been really an improvement in the orthopedic field is the arthroscopic surgeries. We just simply put a camera in the joint, whether the knee or the shoulder or the ankle, and with special tools and techniques we fix the cut ligament or the cut meniscus. And nowadays the fixation techniques are getting more and more rigid, so that when we have a rigidly fixed ligament, as soon as possible in a quiet environment in the knee without cutting the tissues, on the second day after restoring the anatomy by restoring the cut ligament, the patient can start the physiotherapy and rehabilitation program.
Okay.
So that's why usually most of the professional athletes nowadays return to the pre-injury level of activity.
Yes.
In the management of a patient with a sports injury, it's very important to analyze with him before proceeding the pre-injury level of activity. And the target of the procedure is to restore the pre-injury level of activity.
Okay.
For each ligament cut, there are 2 or 3 procedures commonly used and widely accepted worldwide now. We choose the one of them that is compatible with the patient level of activity. We do it to him, then immediately put him on a physiotherapy program to relieve the pain and swelling, and then a rehabilitation program to restore the function, the range of motion, the strength of the muscle. And that's why as soon as possible, within 2 to 3 months from having even a severe injury, most professional athletes go back into the sport that they were doing.
So what are the advice that you usually give to your patients once the treatment is over or during the treatment?
My advice to the patients going to sports is don't follow what's going on around you without thinking of your lifestyle. Customize and individualize the type of sports that you want to go through to your lifestyle. Don't tell me that you are in the office from 9 to 9 every day and then on Friday you want to play soccer or you go for rugby or something like this. No, you choose then simple sports like running or swimming that you can stay 1 week in the office and go to this without injury. If you're want to go to a heavy type of sports, rugby players, skydivers, soccer players, tennis, basket, volley, especially the sports where there is contact with others, you have to have regular fitness training at least 3 or 4 times every week for 2 to 4 hours, training specifically your muscles for endurance. If you go to the gym, don't go for heavy weights, go for simple weights, increase the repetitions. You want to increase your endurance and fitness. Go gradually through this. Things do not come just like that in a minute, okay? Take your time, develop your muscles well, develop your skills, and be devoted to your sports. Don't stop or quit 2 to 3 weeks and then go back once and then 2 to 3 weeks. This is how people get injured.
Yes.
Be cautious while playing. Don't get so enthusiastic to avoid contact injuries. And doing sports really releases the endorphins in your body, keeps you fit, keeps you healthy, keeps your mood fine. So you'll be more productive in your work, and it will develop your self-confidence, and you will act better and better in your daily life. This is the advice for people for sports. If you got any injury, don't say a couple of days and it will go. It might go and it might not.
Okay.
Don't continue the game. Stop the game. Apply ice, rest, immobilization, and ask for professional medical advice. At least you will have to have a simple physiotherapy or rehabilitation program before going back. And if you got a severe injury, it will be fixed as soon as possible so that you don't waste a lot of time and then your muscles get wasted and your joints get stiff and you are left with permanent disability, or at least you will not return to your preferred or beloved sport. Seek medical advice and everything is fine, you will be able to go back.
Okay. So how long will the patients have to take the treatment for this procedure?
Usually the treatment, the procedure itself is 1.5 hours, whether in the knee or in the shoulder, in the ligament. It's 1 day case now. The patients come early in the morning, they have the procedure and go home at night.
Just one day.
Yeah, after such procedures nowadays there is no casting or prolonged immobilizations. Maximum is that for cruciate ligaments for the knee, they use 2 crutches for 3 to 4 weeks, and for the shoulder, they use an arm sling for 2 to 4 weeks. But they will be able to go home on the same day of the procedure and return to their daily activities on the next day. But they will have to have the physiotherapy and rehabilitation program for a minimum of 3 months, if non-professional, and for professional up to 6 months to readapt them to the previous high level of stresses they are subjected to in their sports, to avoid re-injuries and to make them able to perform well during their professional sports activity.
Okay. So lastly, what is your advice to the viewers for having to lead a healthy life?
Generally, for people to have a healthy life, it's about healthy lifestyle. Okay. Nowadays, we have a lot of stresses, and a lot of stresses is the word people using to neglect their own problems, just to deal with what's going on without management. No, management of the stresses starts from you. Adapt a correct posture in the office, have healthy food, do regular training or sports. Simple things. If you don't have time or the capability for that, just walking, running, swimming, these are visible everywhere. And you can do this without having special training for that. Yeah. And don't drive long distances. Don't wake up all night and say, second day I'm tired in the office and this is stuff. Have healthy food. Don't rely on junk food. And then come and say, I have vitamin D deficiency, which is very commonly spread nowadays. So adapting correct posture, having a healthy food, doing regular sports 2 or 3 times every week for 1 hour is the cornerstone for having a healthy lifestyle. Without this, you will gain weight, your activity will become less, your mood will be less, and it's a vicious circle that never ends. So it starts from you and ends at you with simple decisions that you have a healthy lifestyle.
Okay. So that was nice talking to you. Thanks a lot.
Same here. Thanks a lot. It was a pleasure.
So that was Dr. Ahmed Labib with us. Until we meet next time, this is me, Naina, signing off. Take care.